I was 32 when a sudden visit to the emergency room changed everything. If I hadn't made it there in time, I probably wouldn't have survived. Maybe you're here because you're going through something similar. And if that's the case, I'm truly sorry. It's tough, I know. I hope that in sharing my story, it might help you find the courage and comfort to share yours too. I believe that by sharing my journey, from the shock of diagnosis to the process of finding the right medical team, to exploring both conventional and integrative treatments, I can offer you more than just my story. I hope some of these insights could really, truly help you. For 19 years, I've worked as a professional in health and fitness, but it was my encounter with cancer that profoundly deepened my understanding of wellness. I realized that true wellness extends far beyond just workouts and diets. It's about the collective journey of the mind and body, heart and spirit, especially when faced with life-changing experiences. This video marks the start of a series called Rebuilding a Second Life. So today I'll walk you through the unexpected changes I faced leading up to the diagnosis, how I chose the doctors and the hospitals that were right for me, and my experiences with a variety of treatments. But it's not just about medical choices. I'm also going to share a practical toolkit. It's something that helps keep track of everything. Keeping track of all the doctors and hospitals that you've been in contact with, to the names of all your medication, the dosage, how long you've been with it, to bills after bills, reimbursements. Because managing cancer isn't just a physical battle. It can be an admin nightmare. I'll show you more later in this video. Before that hospital visit, there were signs that I definitely dismissed and misinterpreted. A few months before the diagnosis, I started having nosebleeds at the most random times, like during workouts or first thing when I wake up in the morning. Having experienced this in different climates before, and I was traveling a lot, I brushed it off. I also started napping more, which I attributed to my hectic travel schedule at the time. 2 weeks before the hospital visit, my appetite dropped. And I was constantly tired, just struggling to do anything outside of work. I felt dehydrated often, but I was still on the move a lot because I was preparing for my move to Spain. Yeah, I actually tried moving to Spain before this recent move to Spain. About a week out, I started experiencing this radiating pain on my right jaw. It kind of radiated around. I had pain all the way down my neck on towards my shoulder and debilitating headaches. I'm not sure if it's a migraine or a headache, it was just really bad. But it's also similar to what I experienced in the past when I'm sleep deprived. So I didn't think much of it. 5 days before the hospital trip, the fevers started. Despite taking ibuprofen, they kept returning. My eating reduced to almost nothing. I couldn't even keep soup down. I chalked it up to having a really bad case of the flu and unprepared for the cold Spanish March because I was constantly shivering. The night before the hospital, I noticed red dots all over my body, especially around the legs. It was alarming, to say the least, and a clear sign that something was definitely wrong. That was when I started to feel worried, like truly worried. Told my buddy I need to go to the hospital. Next morning, he took me to the local hospital. There, I explained my symptoms and showed the doctor my red dots. And she didn't say much, but immediately sent me to the city's main hospital after giving me an IV bag of paracetamol. At that point, I didn't understand the gravity of the situation. I just thought that was standard protocol, especially as a foreigner unable to speak Spanish. My friend did all the talking. And up to that point, we both still thought that it was just a bad case of flu. So what happened next in the ER? I want to share this part with full transparency because understanding the timeline can be comforting and hopeful for anyone going through something similar. There I was, reluctantly seated in a wheelchair, struggling with the language barrier. I felt lost in the whirlwind of activity around me. No one explained what was happening other than I needed numerous tests. It turns out I needed a platelet transfusion because mine were dangerously low, which caused the red dots on my skin known as petechia. I think that's how you pronounce it. After an agonizing wait, a doctor finally approached to talk. He spoke to my friend in Spanish, who relayed in English that they suspect it's leukemia, but were waiting for definitive results from a specialist center in Valencia. I remember the weight of this doctor's simple, "I'm sorry." Full transparency, neither my buddy nor I actually knew what leukemia was. It's a bit embarrassing, but I had to look it up. Reading blood cancer hit me hard. And somehow my brain fell into this protective logistical mode because I immediately notified my family, my partner at the time, and had to cancel an event commitment. My dad arrived the next day, even before the confirmation of leukemia. I think the prospect of chemotherapy starting immediately brought back some painful memories for my dad of my grandma, my ama, her battle with breast cancer. I think his experience made him ask the oncologist if we could have time to look for alternative treatment instead of starting chemotherapy the very next day. But the doctor's blunt or pragmatic response, depending on how you see it, about the urgency left us with no choice. I remember these words verbatim: "She don't have time, she will die." I began chemotherapy the very next day. Looking back, I see the immense challenges that we all face. It wasn't just a health crisis for me, but a deeply emotional and complex one for me, my family, and my friends. I was diagnosed with acute myeloid leukemia, AML for short. It develops rapidly and is an aggressive type of cancer. That's why treatment started almost immediately. AML has various subtypes, and factors like age, weight, and existing health conditions influences the specific chemotherapy mix. In my case, the doctors went with intensive dosage. For context, I was very active. I worked out a lot. I did a lot of strength training. I was in a somewhat of a healthy weight range. I was young in medical and cancer terms. The health status of someone prior to starting cancer treatment should be taken into consideration. I received 1 round of induction chemotherapy in Spain, followed by 3 consolidation rounds and a conditioning round in Hong Kong. The latter prepared me for a bone marrow transplant. While that last round was the toughest, I was relieved to see my body responding to chemotherapy. To monitor my cancer's reaction to different drugs, I took a specialized test called Onconomics RGCC. Though costly and not covered by insurance, it provided crucial insights into effective therapies for my specific case, especially since AML can progress so quickly. During those 9 months leading to the bone marrow transplant, all 5 chemo rounds required hospital stays, sometimes as long as 6 weeks until my blood count stabilized. The side effects varied, with gut pain and nausea being particularly tough for me. At times, the usual medication barely helped, and I remember feeling scared. Now, nearly 5 years post-transplant, I'm still on medication for GVHD, graft versus host disease. And while intense symptoms of GVHD is actually morbidity, having some GVHD signs are good. They indicate that my new immune system is working. However, it's important to note that GVHD can show up differently and affect everyone differently. Up to this date, I've been under the care of 2 main doctors and 3 follow-up doctors in 4 different countries. A story for another time. But how did I find these doctors? I remember it feeling like it took a village. I got recommendations from clients, friends, and family. The time between leaving the hospital in Spain and arriving in Hong Kong was a blur, and I struggled to focus. But I managed to get an appointment and connect with Dr. Leong in Hong Kong, a leading AML specialist and researcher. At Queen Mary Hospital, where I was admitted, I learned about the possibility of needing a bone marrow transplant. This was daunting, especially considering the risks and the significant costs involved in finding a donor, a process that initially seemed extremely overwhelming and financially stressful. In my quest for the best care, I reached out globally to Europe, to US, to Singapore, and Australia. It was Dr. Chun in Melbourne who restored my faith in the medical system. His approach was not just professional, but also deeply humane. So thank you, Dr. Chun. To help you navigate a similar journey, this digital space, from tracking medication, doctor's appointment, and managing the logistics across different locations. If you find comfort in organization and need a central hub to manage your healthcare information, this template might just be what you need. Throughout my journey, I've discovered that healing extends far beyond conventional treatments. By tapping into my fitness and wellness network, I found invaluable support in areas I hadn't expected. Recovery for me wasn't just physical. It encompassed nutrition.
Is essentially you had a chai latte banana blueberry smoothie this morning.
I got some white fish with some kale.
Emotional and mental health, intimate well-being, and the strength found in social connection. Healing truly is a multifaceted experience, and I'm excited to explore these aspects with you in future videos. So that's the story of the first 9 months after my diagnosis. I've shared the initial steps that I took, the challenges I navigated, and the key decisions that shaped my journey. In our next video, we'll go deeper into managing the side effects and the recovery process. We'll also explore how embracing the various pillars of health is crucial in rebuilding our lives after cancer. A journey that I refer to now as a second life. Will you come along?
Whenever you're lonely, just pick up the